So the ANZCA and FPM CPD program focuses primarily on Aboriginal and Torres Strait Islander and Māori Indigenous peoples, First Nations culture. Why is that, if there are so many cultures throughout, that we focus on these first?
Look, if we just go back for a second, so we kind of use the words, what is cultural safety, and I think we should just go back a step from that and say, why cultural safety as the first thing. And why cultural safety is basically, to me, treat other people like you would like to be treated. And so if we go underneath that and say, and reflect on how we would like to treat people, it actually becomes that the way that I would treat people is based on a balance of my environment, my schooling, my parenting, all of these big things that make up my culture. And then on the other side, that your patient has gone through the same thing. And so your way that you would like to be treated doesn't always directly align with how they would like to be treated. And that is a very big part of First Nations thinking. So their environment, their heritage, way of thinking is quite different to how it might be on the other side in the health system as a healthcare worker. And within Australia, the First Nations were here tens of thousands of years ago. They were the first ones here, and then they've undergone significant, grievous harm, depreciation, everything. In fact, genocide, all of it.
Yeah.
And that is, that is a very real culture. That is a very real thing in Australia, and we need to, one, celebrate that, and two, know about that. So I think if that within Australia, how we focus so much on it, I think that is why it is important. We need to know this. We were fed lies all the way through primary school. We were fed lies all the way through high school. The whole thing was all just made up and all just given to you, and you just had to accept it, and then you did accept it. And then when you found out that was the truth, even in this day and age, you're being lied to about it. So it's, why focus on them? Well, that's why. It's just 350, 400 years of just complete and utter.
It's the right
push down, and it's and we live in Australia. We live on their land. Why are we not? That's the main focus of why we have to learn about it. Does that align with how you feel?
Yeah. And I think I've heard people say, well, what about people who've immigrated from other cultures? And for sure, there's discrimination and racism that people experience and disadvantage. But the really big difference is that immigration, people who've moved here, were not excluded from the legal system, from the education system, from the housing system. They didn't have their money, their income, their wages taken away. They didn't have their freedom of movement taken away, and they could choose who they married. None of that is true for a lot of our colonial history for Aboriginal and Torres Strait Islander people. So there is a difference. It's an important difference. It's very inequitable, and we have to redress it now. So that's why it's a priority.
And certainly a lot of that would echo with the New Zealand Aotearoa Māori perspective, and the cultural safety term, so to speak, originates from, I believe, in the 90s of a Māori nurse. So it comes from a scholarship Aotearoa perspective.
Māori midwives, I think, felt unsafe in their practice, so they, brought this whole thing forward. So.
Certainly, and that was 30 years ago.
Yeah.
And we're still in it.
And it's a fabulous thing that it's mandatory, because it helps us. It's not forcing us, it's helping us to make it part of our professional development on an iterative, annual, not even just once a year, but every month we commit to doing something towards our plan. We'll be better doctors.
That's a very good point you raise in terms of what the CPD can offer the fellows. This is mandatory from the council, MBA, MCNZ, and so the CPD program is trying and allowing and enabling fellows to embark on this as easily as possible. because it's not an easy task.